OCD is a mental illness that involves repetitive, unwanted, and intrusive thoughts, also known as obsessions. These are usually followed by a strong urge to repeat certain actions, like compulsions. Needless to say, the condition can greatly impact a person's life and cause immense suffering. 4 different types of OCD can seriously affect a person's well-being. OCD is an anxiety disorder that can lead to significant distress and even disability. Experts have categorized the different symptoms of OCD into 4 different dimensions, each with its own set of obsessions and compulsions. Each of these categories has its own unique obsessions. However, most of them can be grouped into 4 main categories. You may stumble upon some studies that list 7 types of OCD, but at the end of the day, they all fit within these 4 groupings. Check out these 4 types of OCD and how they manifest. And if you like this video, don't forget to like and subscribe to the Human Mind Project. Number 1, contamination and washing. Let's talk about type 1 OCD, which often revolves around contamination, the compulsive habit of washing. Those struggling with this type of OCD might feel overwhelmed by the fear of getting sick or feeling unclean, both physically and mentally. Everyday things like dirt, germs, and viruses are just the tip of the iceberg. Other things like blood, household chemicals, and even insects or unkept people can trigger intense anxiety and worry. For example, let's meet Sarah. Sarah has a hard time dealing with contamination OCD. She always worries about germs and contamination, so she even panics after touching a shopping cart and must promptly wash her hands. But even though she spends a lot of time and effort on her hand washing routine, she still feels unclean and continues repeating the process in a specific order. Unfortunately, Sarah is stuck in a never-ending cycle of obsessive thoughts and repetitive behaviors that only intensify her anxiety. For individuals with OCD, germs can be a tough issue to handle. They might steer clear of particular locations or activities for fear of becoming contaminated. Cleaning and disinfecting everything is a regular practice for them. They may even get rid of items they deem dirty and create a clean space that is only their territory. But sometimes, despite their best efforts, the germs still find them. And that's when things can turn tricky. They begin to wash themselves and their belongings more regularly and necessary, or they start cleaning their homes to the point of exhaustion. Whenever they do have contact with germs, they become anxious, grossed out, and uneasy, and even hold themselves responsible for potentially spreading the germs to others. Number 2, doubt about accidental harm and checking. People who have a tendency to obsess over accidental harm and checking usually experience intrusive thoughts, impulses, and fears about unknowingly causing harm to themselves or others due to carelessness or negligence. Common examples include the fear of hitting someone while driving or forgetting to turn off the stove and causing a deadly fire. This fear is often accompanied by excessive doubt, dread, and a sense of responsibility. To alleviate these feelings, people may repeatedly check things to prevent potential harm, earning them the nickname checkers. If you're unsure about whether your obsessive thoughts about unintentional harm are valid, you likely have accidental harm OCD. This means that you may be constantly worried about hurting yourself or others, even if the chances are slim or impossible. To ease your mind, you may check and double check things like the stove or locked doors, but this only provides temporary relief before the anxiety and doubts resurface. It's important to get help from a professional who can give you the right diagnosis and treatment tailored specifically to your needs. Everyone's experience with this condition is unique and different. Number 3, just right OCD. Things like symmetry, arranging, and counting. Have you ever been particular about how you organize things? For OCD patients, perfectionism can become a real struggle when it comes to order, symmetry, and exactness. These individuals tend to feel an intense urge to keep rearranging things until they satisfy certain conditions, like having objects on their desks symmetrically aligned. It's been suggested that the constant need for order comes from a feeling of incompleteness that's also associated with compulsive slowness. OCD patients with this symptom category may perform rituals like mental arranging and counting, tapping, or touching objects. And sometimes their behaviors are accompanied by magical thinking, where they believe their thoughts can cause things to happen or not. Some people believe that certain actions or routines can prevent bad things from happening. For example, some might think that if they don't align their dinner plates, something terrible could happen to them. However, not everyone holds these beliefs, as studies have shown. Number 4, unacceptable taboo thoughts and mental rituals. Some people have thoughts that they feel are too inappropriate to talk about or even think about. These thoughts might involve sex, religion, or violence and can disturb the person that's having them. Even though they might not act on these thoughts, they might engage in secret mental compulsions to try and get rid of them. It's a difficult situation to be in, especially if the thoughts go against their values. For example, thoughts about hurting other people or disrespecting religion might be particularly distressing. Usually people who experience these kinds of thoughts aren't violent or impulsive in any way. However, people with OCD tend to consider their thoughts to be a big deal and extremely harmful, which leads them to spend a lot of time trying to suppress them. To try and control these intrusive thoughts, they might mentally argue with themselves over their morals, replace bad thoughts with good ones, pray excessively, or check their actions. These folks also tend to avoid things they think might trigger their obsessions. For instance, they might avoid childcare responsibilities or religious ceremonies. It's worth noting that people with unacceptable thoughts might be dealing with more severe obsessions than those with other types of OCD. Now, we've just gone through all 4 types of OCD, and honestly, the best treatment for your OCD, or treatment that's mostly recommended, is CBT, or cognitive behavioral therapy as it's best known. Now, CBT is a widely used therapy to aid those with OCD by targeting the behaviors and thoughts that contribute to their OCD. CBT can be an effective tool for recovery. One specific type of CBT, known as ERP, involves exposure to OCD triggers without engaging in compulsive behaviors. Over time, this method may reduce the power of OCD symptoms. Other types of therapy, like family or group therapy, may also be beneficial for certain individuals. If you're experiencing signs of OCD, it is highly recommended that you seek the help of a mental health professional with treatment. Most people can resume normal, productive lives despite the disorder's severity. Now, I'd like to speak from the heart here for a moment. I've gone through something very similar to OCD on a very mild level. I've also worked with individuals practicing CBT, trying to help individuals get over their OCD. I know how hard it can be, especially when you get those intrusive thoughts that just don't stop looping and looping and looping. It's so important that you remember that your thoughts are not always factual. In fact, they rarely are. Just because you had a thought doesn't mean you have to act on it, and it doesn't mean it's true. The best thing that I did for myself and the best thing I did for the clients I worked with was to get them to write their thoughts down on paper. It's a commonly used technique in CBT, in cognitive behavioral therapy, is to write your thoughts down on paper. Get it out of your head. And if you're finding that writing it down on paper isn't helping you, the best thing you can do is to get it off your chest by telling someone. Suffering in silence with your OCD and suffering in silence with your intrusive thoughts is the worst thing you could possibly do to yourself. You will drive yourself mental. You will feel like you're isolated and alone, and your thoughts will continue to loop and loop and loop. The best thing you can do for yourself is not be afraid to do things like cognitive behavioral therapy and exposure therapy. Now, exposure therapy can be intimidating in the beginning because you will have to expose yourself gradually to the things that scare you the most. For example, if you have a fear of touching doorknobs for, let's say, cleanliness, you eventually will have to face the fear of touching the doorknob slowly, incrementally. If you have a fear of leaving your home because you're scared of accidental harm, let's say, you will have to slowly expose yourself. Now, it's important that you do this with a trained mental health professional, and I highly recommend that you look into it if you are struggling with OCD, intrusive thoughts, or anxiety. Now, if you're struggling with OCD symptoms, don't hesitate to reach out to any mental health professional. I keep saying it over and over again, but I can't stress it enough. If you found this video valuable, don't hesitate to subscribe and receive more inspiring content like this. Until then, take care.